Welcome everybody to the live streaming of the Public Primary Care Commissioning Committee. My name's Chris Neild and I'm a lay member and chair this committee. So we have had apologies from Brian Hughes and Judy Thorley, and it's likely that Mark will, who's a lay member, will be leaving the meeting early. We've also got, those were the voting members, we've also got apologies from non-voting members of Dr. Amir Afzal and Greg Fell, who's normally in attendance. So we are quorate for the meeting, and if I can now go on to the agenda. So first of all, are there any declarations of interest from the people on the group today that haven't been declared, and if there are any specific items on this agenda, or if the discussion takes us to a place where you've got a conflict of interest, can you draw my attention to it as we go through the meeting? Ronnie, have we had questions from members of the public?
No questions received from members of the public, Chris.
Thank you. So if we can go on then to approve the minutes from the last meeting, which was held on the 10th of March.
Sorry, Chris, I think Mark's got his hand up.
Sorry, Mark.
Yeah, Chris, I just wondered whether we should just say at the beginning of the meeting, I understand that maybe one of the items from this meeting has been withdrawn. Looking at, if I understood an earlier email correctly, and whether we should flag that up.
Yes, yeah. I wasn't sure. I was essentially going to do it as we came to it, but it'd be better to have notice of it in case people are looking at it specifically for that. So, Abby, did you want to say something about the one that's been withdrawn?
Hello, Abigail Tebbs, Deputy Director of Primary Care, Contracting, Digital and Estates at the CCG. Yes, we were due to discuss a merger application at the meeting today. Because there has been a delay to the quality review of the completed QEIA, we didn't want to bring that we made a decision not to bring that to today's meeting, but to defer it to the meeting on the 23rd of June, which will now be going ahead to consider the outline business case for the the Sheffield transformational hubs. So we made a decision to bring that when it was complete, rather than to sort of potentially raise further questions that needed an answer at the meeting today.
Okay, thank you, Abby. So yes, we envisage this might have been the last meeting before the CCG moves to the ICB, but we will be looking at a meeting in June, and we'll have more chance then to get that detailed paper and consultation to you. Thank you for that. So if we can then go to looking at the minutes and checking for accuracy or any other issues arising from them. So page 1 and 2, pages 3 and 4, pages 5 and 6, I think we've just got up to 6, then we've just got the list of contacts. So if we can accept those, Ronnie, as a true record, I haven't seen any hands go up. And if we can go on to the matters arising. So the next item, I think, although it's open, it's about the trend analysis on increasing spend. I don't know if Sandy, if you've got your hand up for this one, or is that just me? It's just me, sorry. Yeah, I think in terms of prioritising the tasks that as we go to the new organisation, then this is moved further down the list. But I understand, Abby, that this may be available before the end of June in relation to another task. Is that correct?
Yeah, yes, I said Thanks, Chair. I've said if possible, I will include this or an element of this within the final primary care report that will come to the committee next month.
Okay, so do we want to change the action then? Or is that okay as it is? Jackie, sorry.
It's okay. So I think it's there are two dimensions to the reason that the query was first raised. One is it's an ongoing pressure in terms of part of the financial overspend, but really is more fundamentally a part of the issues that we are managing in terms of capacity and workforce. So I think Abby's suggestion about bringing it into the final primary care report is the right one. So I think we close this action and put it and open a new one. But there's two dimensions to it that I just wanted to pull out.
Okay, so the thanks for that, Jackie. So if we could, Rani, put on that new action, close this one and put the new action. The next one is, Abby, that's the recommended for closure because we've put the data for mergers. We've already done this task. Is that correct? Yeah. The financial report. So this is on the agenda. It's still open. The next one, digital program update. There were some very specific actions on these, Thomas, that but we've got this on the agenda and we can look at these specific actions on the agenda. Is that right? Or would you prefer to look at these as a matters arising?
On the agenda, if that's okay, Chris.
Okay. Thank you. So are there any other matters arising?
Just in relation to the last matter, Chris, because Tom and I have had some discussion about it, what I would like to recommend is that those actions are closed, and following the discussion, any additional actions are set up as new actions, anything that comes out of that.
So as we discuss it on the agenda, we close these and identify new actions if that's appropriate. Yeah, got that. If you've got that, Ronnie, is that okay?
Yes, thank you, Chris.
Good. Okay, so the papers for approval, the financial report, if I can hand over to Jackie for this. So this is the Q1, isn't it, of this year?
Yeah, so this is the final position for the 21-22 budget and the plan for 22-23. Because the CCG will only be in existence for the first quarter, I'm asking for approval of the budgets that relate to that first quarter. So if I just pull out some of the key points from the report. So you'll remember that Pccc approved the revised financial plan for 21-22 in November. That was the third version of the plan that we approved, recognising that there have been changing financial arrangements in place during the course of the COVID-19 pandemic. So the plan that was approved was to deliver an in-year break-even position, but noting that we had highlighted that there was a recurrent pressure of £2 million within that position that required savings to be identified. We had previously discussed the potential savings that could manage this position. So I'm pleased to report that by the end of month 12, we did secure a number of mitigations to non-recurrently manage that position. We did end up with an underspend at the end of the year of 760,000 overall on our primary care budgets. Within that, the delegated budget from NHS England was slightly overspent at just over £250,000. but there was quite a sizable underspend on the CCG additionally commissioned budgets, and quite a big proportion of that underspend related to some late allocations for IT developments that we were unable to mobilise within the timescales available to us. So they are the main reasons that we had that late change in the underspend. In the report, I did want to draw out, particularly in section 2.1, I've pulled out the fact our spend on the additional roles reimbursement scheme. So whilst we spent the allocation that's within the CCG baseline, we have access to additional funding that's held centrally. The value of that additional funding for Sheffield is just under 3.3 million. But we actually underdrew that by just around 1.1 million. So that was 1.1 million of funding that's been retained centrally that we didn't manage to spend. And in the table 1, I've just set out that there's quite a lot of variation across the primary care networks in terms of uptake of that funding. There are many and complex reasons about why networks have been unable to utilise all of that funding, and we are in conversations with the networks for their plans for 2022-23. The budget for 2022-23 goes up significantly again in terms of the opportunities to expand those additional roles. And we do want to explore with primary care networks about how we might address some of the problems they've experienced today in terms of utilising that funding. In terms of the plan for next year, as I've said, because the CCG will only exist for the first quarter, whilst I've presented a plan for the full year, I'm asking the Primary Care Committee to approve the budgets for quarter 1. And just to remind people that Pccc has the responsibility for approving the use of the primary care co-commissioning, the delegated budget from NHS England. The CCG is responsible, CCG's governing body is responsible for approving the overall financial plan, as well as the additional funding that the CCG commissions from general practice. And the governing body approved the overall financial plan at the meeting on the 3rd of March. I think they were the main things I just wanted to pull out from the report. But if anyone's got any questions or comments, I'm quite happy to take those.
Has anybody any questions or points to raise with Jackie? Trish?
Thank you. Sorry, Jackie.
If you could introduce yourself, Trish. I'm
sorry. I'm Trish Edney, representing Healthwatch today. Just in table 1, I thought that the networks had names rather than numbers. Has that changed?
No, it hasn't. They all had names. Because I hadn't shared the data with the networks, I just anonymised them rather than naming them. I want you to make the point that there's a differential uptake, not actually highlight which ones those networks were.
Okay, thank you. Gareth?
Yeah, thanks very much, Jackie. That was partly my question as well, Trish, but also I wanted to ask about in the report, I think it mentions £22.9 million worth of funding, which I assume is for that quarter, the first quarter, and there's an expected expenditure of 23.3, and then it says a forecasted deficit of 0.6, but I don't know if that 0.6 is an error and it should be 0.4.
Or just take me to where you're looking, please.
Bear with it, I'll just grab it up.
It's on the table 2.
I think it's in the free text. Yeah, so it's on page.
It's under 2.2, isn't it?
Yeah, so the pages aren't numbered helpfully here. So in paragraph 3.1.
Yeah.
1, 2, 3, 4. In the 5th paragraph, it says for quarter 1, total opening funding for delegated primary care is 23 point. Oh, excuse me, so 23.8, which is adjusted to leave funding of 22.9, and then the expected expenditure will be 23.3,
No,
leaving
you're right.
slippage of 0.6. So just wondered, confused myself now, is that 0.4?
Yeah, no, I think the 23.3 should be 23.5.
Okay.
The shortfall in terms of savings that we need to make for the first quarter is about 600,000.
Okay.
Sorry, and thank you, because I did mean to highlight this. So in the same way that we had a recurrent overcommitment in 2021-22, we have a recurrent overcommitment going into 22-23, which is estimated in this paper at 0.6, so just under 2 million for the full year. I did write in the paper that we are still working through some assumptions. So since writing the paper, we've had some subsequent communication from NHS England that we will receive some additional allocations for some of the spend that was built into the plan. So I have been working through with the team this week. So we are hopeful that we can reduce that level of overcommitment subject to those allocations being confirmed as being recurrent. You'll recall we started off with about 2 million recurrent overcommitment. That was forecast to continue into 22-23. I think that will reduce quite a lot. At the moment, the recurrent overspend is looking around something nearer 1.1 million, which doesn't take away the pressure from continuing to look for savings, but does reduce it to some extent. So thank you for asking the question, because it's allowed me to.
Yeah, no problem. Thanks very much.
Thanks, Gareth. I just wanted to ask about the 2.1, and was it in terms of meeting the requirements in the timescale? Was that the issue of not being able to fully claim it? And also, what is I know they're in very different positions, the PCNs, but some of the hurdles that been faced that could claim, only half or less than half of the money.
Yeah. So I think there are numerous reasons for that, and we are just exploring some of those. So some of it is linked to, the key challenge is workforce availability, and actually there's significant competition between networks to secure people. And in some cases there have been a bit of a bidding war. So whoever's prepared to pay the highest salary has been able to secure the roles. There are quite strict rules about what reimbursement you can claim. So some networks have had to go at risk in terms of the salaries they've offered versus the funding they can claim. Some of it's linked to turnover. So having secured roles, people have moved around again in light of that workforce shortage. Some networks have been are more developed and more organised in terms of how they manage and support people in those roles. So there's we're looking about what we can do to support and help networks in developing some of that. So as I said, they're quite complex issues, and I think it is fair to say that a couple of the ones that are quite low on their uptake are in areas of deprivation. So face the same challenges that the general practice faces in terms of attracting people to work in quite challenging areas.
Okay, it's just, you particularly want the money in Sheffield, don't you? So I'm pleased you said that you've already asked for next year's plan, so hopefully we can mitigate some of this. I've got Zach and Abby, and I'm not sure who was first. I was looking.
Abby, do you want to go first?
That would be helpful. Thank you, Zach, because it's just a follow on from that element of the conversation. And we will actually touch on this in one of the discussions at the meeting in private today around some of the approaches that we're taking to help develop alternative roles for both practices and networks as part of ARRS this year and going forward, given the difficulty to recruit some of the more widely accepted roles because of the shortage of workforce.
Okay, thanks Thanks. I'm pleased to know that there is work going on around this area because it is one of our biggest pressures, isn't it? Zach?
It was just to reiterate the workforce is the major issue. It's I think it's really frustrating, particularly for practices in the more deprived areas. They're really struggling to get staff, and not just within the ARS roles, but within the bigger roles within practices. So I think there's a degree of disappointment that when the whole proposal came out, there was an assumption that the workforce were there, that the PCNs could, and I think it has created this really unhelpful competition. And also what it tends to do is the workforce tend to go to the least deprived areas, which is exacerbating the inequalities. So we're working really hard in Sheffield, and I think we're doing pretty well compared to some other areas, and actually trying to get the workforce in. But it is just then stealing workforce from other areas. So I think overall, the workforce crisis is the elephant in the room when it comes to the NHS at the moment.
Thanks, Zach. Thank you. So, yeah, I was saying we're pleased about the plans for next year, and and I share the same views and concerns that have already been raised about the workforce, and certainly we've seen this as a priority for some time, and trying to look at how we might increase our capacity in Sheffield. So thank you, Jackie. It must be very strange doing a quarter budget report, because it's always in the context of what's going forward and what's available. And I suppose some of that is still a bit unknown, and certainly it was last 2 years. So thank you for doing that clear report. So we're being asked then, just taking your points about the fact that the governing body have approved the overall budget, and the primary care budgets, we've got to approve those for April to June. And also there is a significant commitment, just to reinforce, against primary care budgets. I don't know if I missed something. There's a bit stuttery over that, but it's mainly looking for support, isn't it? And specifically, although the governing body got to approve the overall budget, there are some significant primary care issues that we've discussed before, and it's looking at getting our approve your plans. She's nodding. Thank you, Jackie. Okay, thanks for that. So the next item is the one we talked about at the start of the meeting, which we're going to look at in the June meeting, which, because we need to do that in public, it's the merger of Sanniton Medical Centre with Walkley. And there'll be a paper before then as well. So then moving on to the digital programme update, over to Tom, if you want to introduce yourself.
Well, good afternoon. I'm Thomas Cragg. I'm Deputy Director of IT Development and Improvement at Sheffield CCG. We run the Barnsley, Bassett Law and Sheffield Shared Service. So I'll take the paper as read and just call out the key points, if that's okay.
Yeah, and also the
matters arising.
Yeah.
Yeah, no problem.
Yeah. Thank you.
Okay, so we've had highlighted to us from NHS England through the regional team there's been a reduction in online consultations since the end of lockdown. So we'll be looking to do a review and provide some data out that I'll be working with Abby and primary care team to facilitate that. The Yorkshire and Humber Shared Care project, the initiation has been approved, and we're starting to do some work on that one as well. At the end of this document, the report, there's also some more information about the Yorkshire and Humber Care Record for anybody who wants to have some more detail there. Stock management processes. So when we brought the service back in-house, we started asset management for Vivanti, which has also led to changes in how we manage our stock during COVID and the increase in laptops for general practice. We've got more stock in the building at any given time, especially with when the way the deliveries are coming in. So we've had some feedback through a recent building audit that they're really pleased with the way that we're managing the stock and the way that we're doing storage. So that also goes into facilities team. So I'm just really pleased with that feedback. And then moving to the end of the document, there's updates on the Yorkshire and Humber Care Record, the robotic process automation, and the PCN website bid. So bear with me 2 seconds. So the robotic process automation, we've had funding through the digital improvement, and that's around transformation, and that we're looking at 3 key areas in robotic process automation. That's importing structured data from secondary care directly into primary care. The second one is automating the registration of patients with practices. That's part of a national initiative, and also using automated chatbots, chat-based messaging. So those 3 things are moving forward, and we're doing investigations. Peter Thompson from the digital applications team is currently leading on that program, and he's been reaching out to practices to talk to people about things that they're interested in, and that's the short list. The Yorkshire Humber Shared Care Record, some information in the bottom of the document, just if people are interested. We've also got the opportunity to invite the program manager, Keith Naylor, to any future meetings if people would like more information on that. And the last one is the general practice and PCN web presence. I mentioned at the last meeting around a program that's running in Rotherham and Doncaster. We are waiting for some information from Rotherham and Doncaster. They're currently baselining with their web presence, and then they're looking at taking that next step into developing those websites to improve that web presence. And then we using that collateral to write our bid for Sheffield, so that we can use their learning. So apologies, we've not got any more information on that program at the moment, but we are looking at bringing that to the next meeting. So onto the matters arising. Some of them have been covered in the report, but the first one's a number of programs running. So what we've tried to do is bring that information through and add that to our monthly report. So the first one was around the websites. We are looking at that standardisation. We are writing a bid, but we will be liaising with general practice through locality meetings to gather that information once we've had that baseline from Doncaster and Rotherham. There's the place perspective, how we compare. I'm still currently gathering some data. There's a program running called Digital Services for Our Public. We've also been gathering some data. Once that's consolidated, we'll bring a sort of a presentable view back to this meeting. And then the all plans to be brought to the next meeting. That's why we've added that section to the end of the report, just to give more in-depth details on the main programs that are running.
Okay. Any questions for Tom? Gareth?
Yeah, thanks, Tom. It's just a quick one. At the top of your report, it just said about the reduction in online consultations highlighted by NHS England. I just wondered if, because I'm not aware of any sort of targets that they were looking at or anything about that, really.
I don't think there's a specific target. I will double check, Gareth, but I think it's obviously there would have been an increase during COVID because it was one of the new tools, or one of the tools that was in the sort of arsenal to cope, and they've seen that drop. And I think it's just to inform that there has been a drop, and then that will inform future funding around best use of tools and best use of budget. So it's just something that I wanted to highlight to be aware of. And then there'll be some information coming once we've done that review.
Okay, great. That's so clear, because we obviously get subsequent messages from them. I think the most recent message we got from NHS England was wanting more face-to-face. But I can, yeah, so it's a different question, really, isn't it? It's about using the data to guide budgets and IT equipment rather than anything else. Okay, yeah, that's really, really helpful. Thanks.
Gareth, Trish?
Thank you. Sorry, I hadn't picked up about the Yorkshire and Humber Shared Care Record. Is this different system to the ordinary shared care record that patients know and love, or NATE? Or is it going to be different consent forms, etc.?
So this is our. There's a number of shared care record options across the country, and this is the one that we've gone for. It's the Yorkshire Humber Care Record. So it's potentially the one that was mentioned around the consent forms, which was in the press last year. But I can get some more information for you.
I would be grateful for that. Thank you.
Okay, are there any other points? So just going back to the matters arising, which we said we'd close those, but do you want me to add something because you're writing a bid to develop the website, and there's also that other programme about the digital programme for the communities. Do we need to follow that up or at least document it? I think one of the issues for me is that at the moment we haven't got the clarity on what will happen to the business of this meeting and the governance. Oh, Abby's got her hand up, so she might have the answer. But so I don't want to lose it, because I'm so pleased with the, the step change in this digital agenda and the investment, and also, the leadership to get this additional funding in to make a difference.
I don't want to jump in ahead of Tom.
All right.
I was going to suggest an action back to the next, that we come back to the next meeting with the update that Tom sort of trailed on the digital, just some more in depth on the DSOP and the sort of digital inclusion, which might also be helpful, because that was actually a request from Mark, and he can't be here at the moment. So if we bring that back, I think we've had Tom an offer to from the project lead to give a very quick update on what that program is and what the objectives are, which might be helpful to inform that conversation, Chris. Okay, so Ronnie, have you got that? I think it will be useful to have something in the next meeting, which is going to be our last meeting as far as I can see at the moment, so that there will be some document that with some current issues that we still need to pick up. So don't want to lose that cross primary care support and interface, really, because we've had discussions about different needs and glitches, as well as, successes, things that have worked well. Is that okay? I mean, if you want to send a form of words, Tom, to Ronnie, then please do.
No, but I'll pick up with Ronnie. Yeah. Okay,
thank you. So the next item is the oral updates and the reflection on the Primary Care Commissioning Committee. So we have discussed this, and we what's happened is there's been some input into the annual report about primary care and the achievements and some of the key areas of work and governance. We would like at the next meeting, we can take some comments now, but at the next meeting to perhaps do this a bit more formally and send out that section of the annual report to show you what we've already written, in case you would like to add other information and things that have worked, things that have been challenging. So it's a bit more of an informed handover, if you like, that the committee's had some input to. So Abby, did you want to say something about this and how we document that and make sure that we've got something, which we've done some work on between us, haven't we, already, and included?
We have, and you'll remember that we brought a committee annual report up to January 2020, that covered the period up to January 2022. So what we would like to do is just bring a final report from February to June to the committee. And then, as you say, Chris, I think we would welcome, we'll include what went in the primary care report, but just we would welcome any other thoughts or suggestions for inclusion in a sort of in the handover, if you like, and just to spend some time, I think, recognising the work of the committee and the work that's happened in primary care as part of that transition process.
Yeah, and been some major changes, haven't the establishment of hubs and so on. and, you know, a lot of learning from COVID and what's happened in the communities. Is that okay with everybody that we do it like that? And if we also send out the documents we've had, the committee report and the input from the annual report, that'll be useful. And don't forget, we were audited and got a really good assessment from that. So I'm pleased with that result. Okay, so we'll make sure that's on the next agenda. So we've got no papers for noting, and then there's other reports. First of all, is there any other business? No. Key messages to audit, risk, escalation of risk to audit, and key messages to governing body. Haven't got any escalation of risk. We've got some that are there, and Jackie and Abby are saying no as well. I think the key message to the governing body, just to alert them that we're doing this work, and it would be useful to have a steer on where it will sit and who might, you know, own it over this transition process, so that I don't think it will be a gap, but it's just like assuring myself as the chair of the group that we've got a place that can sit as in the transition process, so we've got the clarity, particularly about our place structures. Jackie?
Yeah, just to know, the next meeting of governing body is a short exceptional meeting to consider the adoption of the annual accounts and annual report. So the next full meeting of governing body won't be till the 30th of June. And obviously the day after, the new ICB arrangements will be in place. So I'd suggest, you know, we do that formal update, but there will need to be some work outside the governing body in terms of probably just providing an update on that.
Thank you. So what's the dates for that, Jackie, for the governing body?
It's the 30th of June.
All right. Oh, yeah. So, yeah, well, if we've done that work beforehand outside of it, then it will be an informed, up-to-date document. Okay, so it says the 21st of July on here for the next meeting, but, well, this committee won't exist then. Situations changed around it. So we are looking at, Abby's got a hand up before I speak.
Sorry, 23rd of June.
23rd of June is the next date. Yeah, I was just going to say that meeting, it says on there, isn't correct.
No.
23rd of June, and we'll have a public meeting and a private meeting. Okay. So I think, unless there is any other points that anyone would like to raise, if we can close the public meeting, and thanks for those people that have joined us. I don't know how many you are. I will watch it later, and look forward to meeting